Welcome to part 2 of our lecture on chapter 1, the use of assessment in counseling. In the first part of our lecture, we talked a lot about the definitions of different terms for this class, as well as the purpose and misuse of assessments. In the second half of the lecture on chapter 1, we're going to talk primarily about the history of assessments and where we are now based on where we've come from with assessments. And developments in individual intelligence testing have been well documented since the mid 1800s, beginning with a focus on measuring different intelligence through sensory processes, which was primarily conducted by Wilhelm Wundt and Sir Francis Galton. And they did the sensory testing by things like reaction time. And later, they added in the study of physical dimensions to indicate intelligence through James Cattell indicated as mental testing. And mental testing is now what we call intelligence testing. So, what James Cattell was proposing was that we use physical attributes and physical dimensions to assess intelligence. So, he measured things like height, weight, head size, the length of your middle finger, your lung capacity, the strength of your hand squeeze, and that was the initial start of intelligence testing, was this sensory and physical attributes. It wasn't until the early 20th century that there really became this need in the medical field for us to distinguish between emotional problems and intellectual disabilities. And this need within the medical field set the stage for a more formalized individual intelligence tests, which were being used to evaluate intellectual disabilities. So, one example of this was the Sequin Form Board, which is a test that's still used today. We also have the Binet-Simon scale, which was initially commissioned by the French government to assess children with disabilities in order to assist in educational placement. Specifically, the French government had tasked the researcher Binet with developing a test to determine which students in school would be best to continue in school and which students would not benefit from any further education and should instead be moved out of the education field and into the workforce. So the Binet-Simon was really trying to assess who should continue going in school and who should go into the workforce when they're young. Like when we're talking about the Binet-Simon scale, it was conducted with individuals who were in like the 3rd, 4th, and 5th grade. We also have the Stanford Binet scale, and the Stanford Binet scale was used to assess how people perform on tasks, specifically how gifted they are. And really, the Stanford Binet came out of the work from the Binet-Simon scale because the Binet-Simon scale relied heavily on verbal ability. And the Stanford Binet was used to say, okay, based on someone's abilities, can we determine how gifted they are? Specifically, can we determine their mental age? And mental age came out of the Stanford Binet scale, which was used to compare a majority of children of a certain age to say, okay, based on how well you perform, are you similar to individuals who are of the same age as you, or are you different from them? So, will most students or most children of the same age perform relatively the same, and then where do you fall in relation to that? And it is from that mental age that we developed the intelligence quotient, which is something that we still use today. We just call it IQ for short. So the intelligence quotient was originally proposed by Lewis Terman, and it is calculated by dividing someone's mental age by their chronological age and then multiplying it by 100. So if someone is 11 years old. Chronologically, they are 11 years old, but they have a mental age of a 12-year-old, so they can answer questions of most 12-year-olds. We would take those and we would say, all right, 11 divided by 12 and multiplied by 100, and this will give us their intelligence quotient. And this was a way for us to conceptualize mental level. And it was specifically attached to the Binet-Simon scale and the Stanford-Binet scales. The Stanford-Binet test was actually historically misused in the US history, specifically by Henry Goddard, who used the Stanford-Binet test to assess immigrants coming into the United States through Ellis Island. He was using the Stanford-Binet test to determine whether or not an immigrant coming through Ellis Island should be admitted into the United States. And he found that through testing, 80% of the immigrants through Ellis Island were considered to him, quote unquote, feeble minded. And this was a specific category that said you are performing well below your mental age. And part of the reason why he was finding this specific result is that the Stanford Binet test is a heavily verbally focused test. So it's all based on whether or not you can read and write in English. And if you had an immigrant who was coming in and didn't know English, it wasn't their primary language, or they were just learning it, they weren't going to perform very well. And it wasn't until another psychologist by the name of Howard Knox came into Ellis Island where he was able to develop tests that were more performance and nonverbal that we were finally able to start debunking some of Goddard's findings that immigrants were, according to him, feeble-minded. So it was through Howard Knox's development that we were able to see how intelligence tests could be misused and how the results could be misinterpreted. We also had this primary finding of intelligence around group intelligence assessment. Specifically, group intelligence testing began during World War I as a way to screen new recruits in a more time-efficient manner, because traditional assessments were done individually with one person at a time. And during World War I, when people were being drafted into the army, they needed a way to assess multiple people at once to determine who was going to be the most efficient in a job in the army to fight in World War I. So a researcher by the name of Yerkes developed what we called the Army Alpha and the Army Beta tests. The Alpha Army test measured verbal ability, numerical ability, the ability to follow directions, and knowledge of information. It is most similar to our current intelligence tests today. Then the Army Beta test was a nonverbal test that was used to evaluate individuals who were illiterate or who were non-English speaking. And these tests were used to really assess what type of job in the Army someone would be best suited for. And it was out of the Army Alpha and Beta tests that we really established in our society that there was a need for group testing. Specifically, after World War I, public schools in higher education were needing group testing in order to place individuals in specialized jobs. And this was further emphasized after World War II, where public schools and higher education were really needing to funnel people into jobs that were specialized, that weren't captured in original intelligence and vocational tests. So careers like engineering, pilots, navigators. These previous intelligence tests were limited in the constructs that they measured, and they didn't cover the important functions of jobs like being an engineer, being a pilot. So it was from this sort of social need that we started to develop a broader understanding of what group testing was. And we're going to go a little bit further into that, but I wanted to just show you a little bit of what the Army tests look like. So you'll see here that this is actually a snapshot of the Army Alpha test. And I know it's a little bit hard to see, but this is pretty close to what you would expect from an assessment today, where you are asked questions like, is it wiser to put some money aside and not spend it all so that you may, and then it has three options: prepare for old age or sickness, collect all the different kinds of money, or gamble when you wish. And it was based on these scores or based on individuals' responses that the Army was able to say, all right, here is where we would expect you to perform well based on your knowledge, based on the things that you know. The Army beta test, on the other hand, looked something like this. And this is actually a snapshot of the Army beta test. And in this test, people were asked to identify the objects that are missing in each image. So in image number 1, it would be the mouth. In image number 2, it's the eyes. In image number 3, the nose, so on and so forth. So asking people to identify what is the specific item that is missing. And based on that, the Army could determine how intelligent someone was and where they should be placed in terms of their career in the Army. And it was from this sort of understanding of vocational and intelligence testing that we started to get into ability assessment. And ability assessment was really emphasized after World War II, when there was this high need again for placing people in jobs that were specialized. Tests that we needed to be able to say who's going to be a good engineer, who's going to be a good pilot, who's going to be a good doctor. And there's a particular researcher who's famous for his work in this area, and that's Edward Thorndike. He is known for spearheading standardized achievement tests after World War I. He oversaw the development of several standardized achievement tests in public schools, including rating scales, spelling tests, arithmetic reasoning, and handwriting assignments. And these tests were known that they were reliable in their administration format, and they really paved the way for more group tests that we know today. Some of these might be familiar to you and some of them might not. The CEEB was an educational placement test, so what you needed in order to get into college. The SAT is included in this, the GRE or the Graduate Record Exam. We also have the TOEFL, or the Test of English as a Foreign Language, the LSAT, or the Law School Admission Test. All of these came out of the development and the standardization of assessment protocol that Edward Thorndike spearheaded. And it was from there that we really started to emphasize career assessment. And career assessment has really been popular since the times of the Industrial Revolution, so around the late 1800s. A specific researcher by the name of Frank Parsons established what we call the Boston Vocational Bureau in 1908 to address social conditions in the context of vocational guidance. So, in other words, the Boston Vocational Bureau specifically helped children with career selection through the utilization of career assessment. He would have people come in and take interest inventories and multiple aptitude batteries to really determine where someone should go into school, what you should be educated in, if you should enter the workforce, and what that looks like. And it was through this development that we started to see high school students and military recruits being used, being funneled into the assessments that they were doing or funneled into the careers that they were doing based on the assessment results that they had. So, some of the assessments that came out of Frank Parson and the Boston Vocational Bureau's work are things like the Strong Vocational Interest Blank, the Cooter Performance Preference Record, and the ASVAB, or the Armed Services Vocational Aptitude Battery. Maybe some of these assessments are familiar to you because maybe you took them when you were in high school. That's pretty common because it was the work of Frank Parsons that really emphasized, all right, we need to have children assessed while they're still in school to determine what career they should go into, what they should major in school. Should they join the Army? What should they do with their time moving forward? And from career assessment, we started to develop personality assessment, which really began in World War I with the use of what we call the Woodworth Personal Data Sheet, which was a tool for screening military recruits. Specifically, clients who were taking the Woodworth personality data sheet were asked to answer 116 yes or no questions, and the test was specifically designed to detect mental health problems. So, a couple of example questions from the Woodworth personal data sheet would be things like: do you have a strong desire to commit suicide? Do ideas run through your head so that you cannot sleep? And are you bothered by feeling that things are not real? And testing from this era of personality really started to evolve into a more expanded study of personality through objective tests like the MMPI or the Minnesota Multiphasic Personality Test, and projective tests such as the Thematic Apperception Test and the House Tree Person Test. And we'll talk more about the MMPI and projective tests in Chapter 13 and Chapter 7, respectively. But today, assessment is used in a multitude of settings to examine a variety of vocational and personal intelligence and ability constructs. And we would expect that in the future, assessment will continue to be innovative and socially conscious as technology increases and the diverse world becomes more connected. There are many reasons why people in the helping professions select the instruments that they do. And counselors choose assessment based on a variety of factors, such as whether or not their discipline requires it or has a preference for it, if they have personal training and qualifications to use a specific assessment. Depending on the client issue, that might influence what type of assessment someone picks. Whether or not we need the assessment to show intervention effectiveness can also play a factor in our assessment choice. Whether or not we are using an assessment can be informed by why a person is coming in for an assessment. If they came in self referred or if they came in by someone else's referral. We can also use previous testing experiences to inform what tests we want to do. This is particularly common for people who do assessments frequently, but if you have more exposure to a test, then you're probably going to use a different test to assess the same thing because you don't want someone to have too much experience with a test. Test quality also informs what instruments we choose to use in our assessment, and also our agency or the setting in which we are doing assessment matters. A lot of times, assessments and tests cost money, and our agency is the one that's paying for it. So, if our agency can't afford a test, that's going to heavily inform what assessments we use. But also, our theoretical orientation can play a factor in what assessments we choose to use. And this is just a very broad sort of overview of why and how we choose what assessments we use. But overall, we use assessments because we are making an informed decision about what the client is looking for, why they were referred, and what they're looking for out of our assessment. And current research indicates that there's a lot of overlap between the most frequently used assessments across counseling specialties. So sometimes, even what you are as a counselor, your title can inform what assessments you use. But there are some distinctions in assessment priorities. So, people who are mental health counselors are oftentimes more inclined to use things like personality assessments, where school counselors face an increased pressure to understand and use ability and intelligence assessments. Career counselors, on the other hand, might use a variety of assessments that explore client skills, interests, and values. And there are some discrepancies between which assessments counselors are trained to use, as well as which tools are most used in research, and what counselors encounter in practice. So, as counselors, it's important for you to learn about these tests so that you can use them successfully in your own practice and so that you can interpret scores on tests for clients when they are referred to you by other professionals. So that's part of why we're taking such a wide view of assessment so that you can understand not only how to administer them, but also how to interpret them if you're not using that particular assessment. And if you want to know a little bit more information about assessments broadly, I encourage you to check out the table 1.3, which breaks down the most commonly used assessments by the profession. In order for us to determine what assessment we want to use and how to select an assessment, there are a few key questions that we have to ask ourselves. And those include who is making the assessment? So, was the person self referred or were they other referred? Did someone encourage them to come in and get the assessment? We also have to ask what is being assessed, where the assessment is going to be taking place, when the assessment will be occurring, why the assessment is being undertaken, and how the assessment is conducted. And all of these questions are going to help inform selection of an assessment for our clients. So I want to break these down just a little bit further. One of the first questions that we ask is who is making the assessment? And most often what we're talking about is S data versus O data, whether or not someone was self-referred or other referred. If someone was self-referred, most often we are going to get S data, which is the data that that individual reports having experienced. We also have O data, which is the data that we collect from external sources or individuals in someone's life. Both S data and O data are needed for us to fully appraise an individual, especially when an individual's self-appraisal might be distorted or limited in some way, such as if we're asking someone to report on childhood disorders and they don't have a memory that far back, or if they have a personality disorder that is occluding their insight, or if someone has a problem with substance misuse that is occluding their ability to understand what they're experiencing. So as you can imagine, S and O data complement one another, and really they're used to help substantiate the existence of oftentimes less favorable diagnoses that someone might not always have insight into. The second question that I asked is what is being assessed? And oftentimes the subject of an assessment can be individual or can be environmental. Environmental assessments might be something like assessing in a classroom atmosphere or getting residence hall settings, just assessing the environment that someone's in. And these can provide an important information for understanding a treatment problem that's being presented to us. Individual assessments, on the other hand, can involve evaluating how an individual expresses feeling, thinking, and doing. Most individual-based assessments are what we call nomothetic, or they're focused on capturing the variables that are most helpful across a more general population. Sometimes we have assessments that are more specific to unique variables that only apply to the individual in front of us, and we call those assessments idiographic assessments. We also have to ask ourselves where assessments are taking place, because assessments can be administered in standardized format, which provides us the best opportunity for interpreting results properly, or they can be administered in a naturalistic environment, which is often best when conditions may vary considerably from different individuals, such as employment ratings. We oftentimes want to get an assessment of employee ratings in the environment of their job because it's largely going to influence their ratings. Interpretations of our results must be taken into account in the setting in which the data was obtained. So if we are getting information in a standardized format, we want to interpret it that way. But if we're getting information in a naturalistic assessment format, we want to interpret that with that in mind. We also have to ask ourselves when an assessment is occurring. If an assessment is tracking current behavior or if we're asking someone to recall previous information. And this is going to change the way that we interpret assessment results and how we assess an assessment specifically. We're not going to give someone an assessment on their previous behavior if you're looking at current problems. You're probably not going to need that, and the vice versa being true. That's not always the case, but it does inform how we choose to assess information. And we also ask ourselves how assessment is being collected. Because assessment data can be collected in an objective way or in a projective way. An objective assessment is one that's able to be viewed by multiple people and it's undisguised. We can see it, we know it, we can describe it. A projective test, on the other hand, is disguised in a way that makes it difficult for clients to fake their answers. And also, assessments can be broken down into both qualitative and quantitative assessments. Quantitative assessments produce a very specific score that falls on a continuous scale. Qualitative assessments, on the other hand, produce a verbal description of a person's behavior or a situation that can be placed into one of several categories in nature. So, by their very nature, quantitative procedures have been more thoroughly studied in terms of reliability and validity, where qualitative procedures, however, are more open ended and adapted for use in counseling, especially with diverse clientele. So, when a counselor is determining what assessments they want to use, they really have to take all of this information into account in order to make an informed decision and to choose the assessment that makes the most sense for the person in front of them who's seeking the assessment. So, to wrap up our talk on chapter 1, I present to you, and this will be true for every chapter that we go into in this course, but I'll give you some questions for review. Things that you might want to ask yourself so that you have a pretty solid understanding of what this chapter was about, so that you can use this while you're studying for the exam for this course. So, take a screenshot of this, pause here, do whatever you need to check your answers on these, and I will see you all in the next lecture.